Good afternoon. I'm George Latimer, Westchester County Executive. It is Monday, October 5th, and this is our weekly COVID update for the outbreak here in Westchester County. I want to highlight that we're here in the media room on the 9th floor of the county office building, and we are at least 10 to 15 feet away from the other people in the room. So I've removed my mask so that I can be more clearly understood. I don't have folks around me, so we'll try to make sure that we protect the people that we work with every day and do the best job we can of mask wearing. And we all make mistakes from time to time. But just so it's clear, you may not see the room as I see it from where I'm standing behind the podium, but those that are in the room are at a good distance from me, so that's why I've removed the mask. We do not have the statistics yet up on the New York State tracker for today, as Monday. So I'm working off statistics that were available as of Sunday, October 4th. And we're showing, the continuation of the same pattern in Westchester County that you've seen over the last number of months, which is a relatively low level of infection. Because of the high amount of testing, we're getting a high absolute number of cases, but as a percentage of all the people testing, it's still staying in and around the 1% number. And we still have what we consider to be low hospitalization and low fatality. The numbers as we have it through Sunday. 38,475 people year to date tested positive for COVID. 37,801 of those individuals cleared the 2-week period of time, leaving a total number of active cases at 674. Now, that's a high number. That's a higher number than we've had in the last number of weeks. It's actually 2 down from the day before, but significantly above. We were reporting numbers in the 500s and 400s a couple of weeks ago. What that is a reflection of is still a low percentage of infection in the 1% range, slightly above, slightly below, but a much higher amount of testing. So as we look at the numbers, over the last day, we tested a little over 5,000, about 5,500 individuals. That's a significant number of daily testing. If you go back to the early part of the pandemic, we were testing probably about 3,500 to 4,000 a day. We had 44 positive tests out of 5,500. So that, as you can see, is under 1%. 5,500 would be 1% of 5,500. So at 44, that's a good percentage. It'd be great if it was 0. But under 1% is considered a good percentage. It's a low level of infection, but it's still 44 more individuals that tested positive. And then if you go back to where we were 2 weeks ago in the incubation period, on the same day 2 weeks ago, we had 46 people tested positive. So that means that there's 2 less today proportionate to where we were 2 weeks ago. That's actually why our numbers went down by 2 in active cases. But if you go back 3, 4, 5 days ago, you'd see that the number of people that we have testing positive, last week we had nights of 35, 44, 57, 61, 46, 85 people testing positive, which is a higher set of numbers than the 2 weeks prior to that, where the numbers were lower. So one of the indicators, number of active cases, 674 through yesterday. But a positive figure is the amount of infection percentage, and yesterday's number, 44 on a base of 5,500, less than 1%. Now, our colleagues over in Rockland County are experiencing a higher infection rate. That means that on a given day, the number of people that tested positive is a higher percentage of that total. And they've had some issues over there. I know they're working to do it as best as they can. Orange County has had some issues like that within the last week, maybe not as recently as so. We're here in Brooklyn. Those are situations that are also very high. The governor has indicated that he expects us to take special activity on those zip codes that have higher numbers, and none of the Westchester zip codes reached the top 20 in the state for infection percentage. So at this point, we've tested 688,920 tests for COVID. Now, I have sort of minimized the number of duplicate and triplicate tests, but now we're seeing a higher number of duplicate and triplicate tests. So I can't make a direct correlation between the number of tests total as a percentage of population. And roughly 1 million people in Westchester County, 688,000 tests would be 68% of the population if each test was one only. But whatever the factor is, it's still not going to knock that number much down below 65%. So you'd have to have like 30,000 tests with duplicate tests. That's not likely. So we're still testing a very high percentage of population. When we looked at it a couple of days ago, we were well ahead of Nassau and Suffolk and the other counties in our region, testing a higher percentage of Westchester residents. So if we're at 65%, 2/3 of our population tested for COVID, that is a good thing. But as you hear all the time when these explanations are given, a test, positive or negative, is a snapshot of that moment in time. A person might test positive today and then could, in theory, become positive, could be negative today, might test negative today and might turn out to be positive in a couple of days, either because the virus is in the system and it didn't show up in the test, or because they're exposed to the virus a few days after a negative test result. So we don't view these things as absolutes. They are trend lines, and you look at all the different trend lines to see what the overall picture is. We're looking as well at number of hospitalizations. Number of hospitalizations as of the last date we had on Saturday, the 3rd, was 26 people hospitalized. That's right about the lowest number that we've had throughout the whole pandemic. We had 25 earlier in the week. And just to give you a flow of it over the course of the week, starting Monday the 28th, 26, 27, 25, 30, 33, 26. So it's an oscillating number depending on who gets released and who's satisfied from the hospital standpoint that they're healthy and can go. And then there's also some percentage of people coming in who are new. But when we have that number ranging somewhere between now the mid-20s to the mid-30s, that is a good sign. If those numbers started to spike along with the number of positives, then we'd be looking at that with a great degree of concern. And ultimately, looking at numbers, if all the indicators start to go up, then we're going to have to shut down elements of our society that people interact, because that means this spread is occurring in a way that's profound. And that isn't what's happening. In a second, I'll talk about some of the things we've gotten through already and some of the things that are coming up. And these things would have to be shut down if we saw that there was an increase in hospitalizations as well as an increase in infections and an increase in active cases. The final and the most serious statistic, obviously, is fatalities. We had one fatality on Saturday into Sunday. That brought us up to 1,457 fatalities. That is the only fatality we had, not just in the last week, but in the last 10 days. And our fatality numbers have been dramatically low, although, and I say this every time I say it, every fatality is a human being who has died, somebody who loves them, they love somebody, a friend, a neighbor, a relative. So I don't want to minimize even a single death. But if we're looking for trends to determine, are we spiking up? That's the biggest question I hear. What's happening in Westchester? Are we spiking up? The answer is no, because we have low hospitalization numbers, we have low infection numbers as a percentage of all people tested, and we have a low number of fatalities. And that low number of fatalities, just to give you a rough metric, we've had over the course of the last 2 months, 10 people die from COVID. Again, 10 tragic situations for those individuals. But 10 over 2 months is an extremely low number given where we were in the heart of the pandemic, which is more distant now in our memory. It was March, it was April. March is more than 6 months ago. April is about 6 months ago from now. So it seems like something happened a long time ago. But those numbers didn't come down by accident. They came down because of mask wearing, because of social distancing, because of hand sanitizing and making sure we don't have large gatherings of people. And it's hard to do. There are people who want to have receptions for any number of reasons. We've survived the high school graduation period. I know of people who've had to postpone weddings, or at least the wedding receptions that go. We have had, unfortunately, been unable to mourn our dead through the normal funeral structure or wake or shiva structure, all of those social things. Major holidays, whether they're religious holidays, Easter, Passover, now most recently Rosh Hashanah, Yom Kippur, all of those holidays, the civic holidays, the July 4th Independence Day, the Memorial Day, they've all been altered. Some of them have become virtual. Some of them are being postponed for the future. And in each of those different cases, the mission is to try to avoid having large groups of people in a singular place where the chances of spread are greater. Even with masks on, there is some spread. So we have to make sure we have masks on, we have to make sure we're sanitized, we have to make sure we social distance, but even the volume of people, because of air structures when you're indoors, could potentially increase the spread. So that's why we've had to disincent having that many people together. That's why if you're watching the NFL or the baseball playoffs or the basketball playoffs, you're watching them perform in empty stadiums. Now, what's the message that goes out to people? These are difficult times, and this is a serious disease. I think we've seen, the unfortunate reality of the president contracting COVID. We hope he recovers fully, he and his wife. But the point is, it can hit any of us. It could hit me, it could hit you. And these prudent steps that we take are prudent steps. They are not mind control. I react very quickly when I hear people talk about you just want to control what I do. I don't care what you do day to day, as long as you don't increase the spread. That's the problem. And when you have fatalities, that's why this is important. If this was not a fatal disease, if this is a disease where everybody got sick and walked away fine, it wouldn't be a problem. But we lost a lot of people. Now we're losing less. Why? Because we're lucky? No, because we're following as well as we can the provisions that the public health professionals tell us. So now we're at a position where our fatality rate has dropped under 4%, which is good because at some point in time it was well above 4%, meaning 4% of everybody who tested positive suffered fatality. That number is high because of the people we lost earlier in this cycle, but with the lowering number of fatalities, that number as a percentage is dropping down. It's 3.8 now. We hope it drops down as low as it can, given the number of positives that we have. So the overall picture, just to summarize before we talk about some other specific elements of this, is that we still have a control in the infection percentage in Westchester County. It's still around 1% on a given day, maybe a little higher, certainly a day given lower. Our total number of active cases are larger, but we are testing far more people now than we were on a given day 3 or 4 months ago. The hospitalization numbers are as low as they've been throughout the whole pandemic, and the fatality numbers are as low as they've been. This is not a way to pat ourselves on the back. This is not a way to drop our guard. This is just a factual analysis of where we are. And I will tell you, if the numbers go the other direction, we will be straightforward and we'll express that as well. Why does the trend line matter? And the fact that it hasn't spiked, because we've been through some very specific situations. We've opened all of our gyms and health clubs now. We went through a process where the Department of Health and the local building department had to go in and sign off on a protocol. We've opened them now for a couple of weeks. There's been no increase in spread. That's a good sign. We had an outbreak a month ago in a church in Pleasantville where 2 priests and 1 other staffer came down with this, and we feared that that might be a huge cluster in Pleasantville. Not an additional positive came out of that. Why? Because the priests involved wore masks, sanitized their hands. The parishioners did not congregate as you normally would in a religious service or touch things that might spread the virus. So we practiced the right behaviors, and we avoided seeing the spread, even when you would have thought we would have had the spread during the vacation season, over the Labor Day weekend, which is now, we're a month past Labor Day, and we've cleared that period of time. Almost all of our summer recreation programs have been completed. We opened the pools, went through a normal season, and closed them, limited capacity. Same thing for the beaches, no spread. So all of that is good news, but it doesn't give us license to treat it as if the disease isn't there. And again, what we've just seen in Washington tells us that the disease is always with us. And until we get the vaccine, until we get the antiviral treatment, we have to treat this as the dangerous situation that it is. I would mention that as our summer recreation programs are just about over, we still have our public golf courses open. Golfers will play on New Year's Day if they could get away with it. But the bottom line is we'll keep the courses open during the month of October and into November. And our Bicycle Sundays have 2 more weekends ahead of us. We had an extended run during the summer where we normally do not have Bicycle Sundays, but because we didn't have other events, Playland and Kensico Dam festivals, we kept Bicycle Sunday open, and we had a terrific year. I mean, we set all kinds of records for participants because we had the extra days. But Bicycle Sunday will participate on Sunday, October 18th. And on Sunday, October 25th, and then that will be the end of Bicycle Sundays. Not this weekend, because this is a federal holiday coming up a week from today and a longer weekend, so we don't usually do Bicycle Sundays on those kind of weekends. But 2 more weekends for Bicycle Sunday, and then that program ends, and I'm very happy that from when we started it in May, there was some fear about spreading the disease. That hasn't happened. We have gone through a period of time where restaurants in Westchester County are now open, both indoor and outdoor. Where our retail stores are open, including those internal in malls. All of our offices are open, and we have not increased the spread. So all of that is good. Now, if anything turns the other way, these would be the things that you would have to make decisions about reclosing. The power to close those things resides with the governor. He has taken his executive authority as a chief executive in the state to make those decisions. The county controls its recreation department and our own physical facilities. So we could decide to do certain things with the 4,000 plus employees of the county government. We would have to negotiate with the FAA, but we have influence over the airport, the bus system. Those are things within the county's direct control. But the governor controls societally what happens on a broader basis. And as he's indicated in his press conference, he's looking very clearly about those areas where the outbreaks are spiking and going much above the norm. Fortunately, none of those places at the moment are in Westchester County, so we're grateful for that bit of news. We do want to mention that there has been some limited resumption of commercial flights at Westchester County Airport. Now, for those who may not know how the airport is structured, we have about 20% of all the flights in a normal year that go in and out of the county airport are commercial flights. So you go to the main terminal, you get on, an American, a JetBlue, any of those commercial flights, and you book a ticket and you fly. 80% of the flights that go out of that airport are general aviation. Now, people think of general aviation as I either have a plane or I rent a plane, and you and I together get in the plane and we fly to, the town where your son is going to college or something like that. But most of general aviation are from fixed-based operators who provide jets for corporations and for individuals that have access to that. That is 80% of the traffic at the airport. General aviation is down about half, 40% to half of what its normal would be, and commercial flights out of the airport dropped to zero. And the zero has nothing to do with Westchester County. It has to do with the tremendous drop nationwide in air traffic. And I think we all understand that. People are less willing to travel long distances. And on top of that, they're concerned about being in a confined airplane with a confined ventilation system for 5 hours to the West Coast, 7 hours to Europe, whatever that might be. So with those things in mind, we've seen a closure of, or an elimination of all commercial flights for quite a period of time, number of months. So two airlines have resumed service. We have resumed service to Florida that began on October 1st, and then upcoming in 2 days, flights will resume to North Carolina, and that's JetBlue and that's American are the two carriers that are going to resume those flights. There's going to be a couple of flights a day, so we're not going to go back to sort of the madhouse mornings and the madhouse evenings that you might see at that airport, almost like a commuter train station. And the people who are concerned about overhead flights will see a few more flights a day, but not a tremendous amount. However, those airlines are going to judge whether or not they continue service into Westchester County Airport on the basis of whether or not there's a demand for it. And if the demand does not materialize, then they may retract and eliminate those flights. So if you are going to use flights out of Westchester County Airport, commercial flights, JetBlue and American, call the carrier, make sure you know that the flight is there, is going to go, and we're certainly monitoring this in all times. On board, there's lower capacity. No middle seats are being used. There's a host of things that have been established by New York State to give passengers quarantine notification when they arrive here in Westchester County in the state of New York. And of course, the airport serves Connecticut as well. But there is some resumption of air traffic at the Westchester County Airport. That's the basic message. That is a sign that things are better today than they were. It's not necessarily a sign that we've fully come out of all of this, but that is a sign, and we're grateful for whatever sign that we can see. Just in a couple of other things while we're chatting, give you an update on some other issues that are related to this. The court made a decision to extend the counting of Census 2020. There was an original end date of October 31st. There was the federal administration made an announcement that they would stop counting on September 30th. There's been a court action that has overruled that, and so the census count continues. At last look, Westchester County has already surpassed overall the percentage of households responding that we had in 2010 and in 2000. So we've already surpassed that in 2020, even with all of the COVID difficulties in doing the count. So not only have we passed our own records, but we are pacing ahead of the statewide percentage, and we're pacing ahead of the national percentage. That's all very good news for Westchester County. We have, in round numbers, something to the tune of 32 or so of our municipalities. There are 43 that are counted under the census. 32 of those municipalities have surpassed what they did in 2010. And those numbers are significant. They're better than what we did in 2000. We hope that will mean, when it's all said and done, that the accurate count of Westchester residents will put us at about 1 million people. We'll see. We won't know until the actual numbers come out in April, but we're encouraged that we have the additional time to count. So if you haven't yet responded to the census, there is time for you to go online, my2020census.gov. You can do it in less than 10 minutes. Or if you still have a copy of what you were mailed for census, you can respond that way. Or there are people out there from the Census Bureau that are enumerators who will knock on your door if they haven't already. They left a note, call them back, and make sure you're counted in the census. That's a bit of good news as well that we have to deal with. This Thursday, October 8th at 7 p.m., I will be delivering my delayed State of the County message. You're familiar with the President does a State of the Union message, usually very early in the year. The Governor, usually around the first month of the year, does a State of the State message. Local towns and cities, mayors and supervisors do their update. And usually we do it in Westchester County in April, but we delayed it because of COVID, and we wanted to give an accurate State of the County, and how could you tell in April exactly where we were and where we'd be? But I will be giving it this Thursday at 7 o'clock. It'll be broadcast in the Board of Legislators chamber on the 8th floor. This will be my third State of the County message since I've become county executive. I made it a point of returning the speech to the County Board of Legislators chambers so that it's an address to the members of the Board of Legislators, executive branch, communicating with the legislative branch in a transparent way so that the public can see as well, laying out some of the things that we've accomplished in the last year and some of the problems we've had and some of the challenges we have and the things we hope to accomplish in the next year. And you'll be able to see that on Facebook, whether you have a Facebook account or not. You can go onto Facebook /WestchesterGov, and that should get you free access into seeing it. And of course, various media outlets will cover it. And electronic media may cover it live. We'll determine that. Just follow your various media outlets, and you'll know. And then there'll be some reporting about what we have to say. We'll certainly circulate information after the fact. In Washington, the House of Representatives have passed an act. It's known as the HEROES Act. It's an acronym. And it was passed by the House of Representatives. It now awaits action by the Senate if the Senate chooses to act. We want to thank the members of the Westchester Congressional Delegation for supporting the HEROES Act. And that would be two outgoing Congress members that we've had for many years who've served us, who are completing their congressional career at the end of this year. The wonderful Nita Lowy and the wonderful Elliot Engel, both of whom were supporters of this, and then also Sean Patrick Maloney, who's a congressman who represents a portion of Westchester County. His district goes up into Putnam, Dutchess, and Orange counties. And the act itself includes lots of very specific things that benefit the county. And I want to enumerate a few of them quickly because I think it's important for you to know. You hear about the battles in Washington, and you'll hear something like the HEROES Act. What does it really mean? Why is it important? Funds provided by the federal government can be used by the county to offset lost revenue. We have right now a budget gap because when we closed the society down in March, Governor made the executive order, stop the spread, businesses closed. Before they reopened in the phases in June, we lost money, businesses lost money, but the county government and other local governments lost important sales tax revenue, hotel tax revenue. The funds in the HEROES Act can be used to offset that lost revenue so we can balance the 2020 budget. And we can do that without layoffs or furloughs. And people might say, well, this is something that you should have to do with employment. The more people you lay off, the worse the economy will respond when that happens. So you should try, and we're trying, to avoid layoffs, avoid furloughs as long as we can. And if we can do that with this help, that would be important. The additional Medicaid percentage money that we would receive will help offset our different actions. It would repeal the SALT deduction elimination for the year 2020. That means you as a taxpayer, when you file your 2020 income taxes in 2021, you will be able to claim the SALT deduction if this becomes law, just for the single year. That is a benefit to you because you have experienced economic difficulty as an individual, whether you're a homeowner, a small business person, a person who works in a large corporation. If you work in a large corporation like a hotel or an airline, you may have very just as easily lost your job as you did if you were in a small business that went under. So there are industries that have been greatly affected by this, and the elimination of the deduction elimination would be beneficial, and that's in here. There's a repeal of the T-band provision, which is important in telecommunications. It would resume unemployment benefits enhancement with direct payments and for dependents. It would fund the election processes that we're going through here. It involves CDBG money, community development block grant money, which is very important to many of our communities. Our 4 major cities tap that for work that they do in those communities. And then separate from that, we have an urban county consortium of 30 communities that join in as a group, and then we apply for CDBG money, which can go to do very specific positive things in Portchester, in Elmsford, in Tarrytown, and any of the participant communities. There's money in this budget, in this proposed bill for the Department of Education to support states' education, and we're talking right now about a reduction in school aid. It may not be the county's direct situation, but the quality of our schools is one of the major reasons why people live or stay in Westchester County, and properly funding the schools means that there won't be a diminution of educational support, and that's critical in the urban districts and the suburban districts. There is money set aside for higher education, $11.9 billion, which would help to deal with the problems that college students are facing, college administrators and teachers, in delivering college education when you have to do it remotely or you do it in a way that is untraditional. So all of these things are included in the bill. It is an effort in Washington to deal with a crisis. This is not creating a bureaucracy for the sake of a bureaucracy. And look, there's philosophical differences that people have. Those of you watching may hold different political views than I have. I understand. I respect the fact that we disagree. But these are the moments when the federal government has to step forward and help local governments, local businesses. We're doing what we can do with the Business First program and some grants through our IDA funds to help businesses. We've announced a few weeks ago work that we're doing to try to help people that have housing problems. We announced more money for people that have food insecurity and can't find sufficient, they're out of work and they can't get sufficient food for their family. All of these things are meant to deal with a nation in crisis. Now, as controversial today as it might have been then, the work that Franklin Roosevelt did during the Great Depression was an essential element in putting the United States back on its feet. And it is a question of whether or not the federal government philosophically determines that it is their job to do so. And I would argue it is, because the pain and suffering of Americans cannot be ignored. You can't look at it and say, well, I'm glad that's not me, or it's too bad, the invisible hand of the market will balance this out in future days. In the present, people are suffering. In the present, people are without employment and they're without food, willing to work, not looking for a handout, but needing that hand up in this moment. The HEROES Act does that. The Board of Legislators came out with a very strong letter in support of this. I credit them for that. We've spoken up in support of it as well, and we think that's an action in Washington, D.C. that would help us out. And then the final bullet that I want to share with you is that we are now in the county government preparing the county 2021 budget. We operate on a calendar year, fiscal year. That means our calendar year begins Our fiscal year begins on the first day of the calendar year, January 1st, runs to December 31st. The Board of Legislators, by law, must receive from the administration the proposed budget on or about November 15th. Usually it's delivered between November 10th and November 15th. We will deliver a capital budget plan to the Board of Legislators within the next 10 days. I think October 15th is the charter-driven date for that. So the Board of Legislators will review both of those two budgets, the capital budget and the operating budget. They will make changes to it as they see fit, and they will hopefully adopt a final version, a modified version of it, which I would then have the opportunity to sign, or I could veto, line item veto, or veto in general, and there's an override provision. But all of that has to be done on or about the 20th of December. We prefer to do it in this county a lot sooner because we've never had a late budget, and we don't intend to have a late budget. But the bottom line is we want a budget in place for December 31st so that when comes January 1st, a new budget is there and we can function. This is a very difficult time to do budgeting because you're trying to estimate revenues without knowing when do we find the vaccine? When do we find the antiviral treatment? When will people feel fully comfortable going back out into the society to purchase things, to consume products and spend money doing it? When do they feel comfortable enough? When do businesses feel comfortable enough that they can rehire staff? All of that goes into estimating revenue and determining what kind of costs we have. So we're in the process now of doing that. We have, from where I'm speaking, slightly over a month to finalize the budget presented to the Board of Legislators. We established 2 budgets ago. So we did it for the 2019 budget in 2018 and the 2020 budget in 2019. The first ever executive branch budget forums where people can come and give us input on what should be in the budget without having the budget in front of them. Usually what you're accustomed to is public hearings by the legislature that follows the receipt of a formal budget where people comment on what's in the budget. It doesn't have enough for this, or we shouldn't have this, it should have that in, whatever the concerns are. The tax rate isn't to their liking. But these are budget forums that we are conducting as an executive branch prior to the submission of the budget. Mark your calendars. We'll give you more specifics in the days to come. 2 weeks from tonight, Monday, October 19th at 7 p.m. in New Rochelle. And the following night, Tuesday night, October 20th, same time, 7 o'clock, we will be in Mount Kisco. We'll give you the locations and plenty of opportunity. It's an open forum. People will come and speak. We'll announce how much time they have to speak. We will limit people to that time. They can submit written testimony, and with that input, we'll prepare a budget and we'll submit it to the Board of Legislators. So that gives you at least a pretty brief update. We haven't touched on a number of other things which we've talked about in other days. If there are questions from our friends in the press, we'll take them, and then we'll certainly try to communicate, what the status is of some of the other things we're working on, the Business First grants, the IDA grants, the things that we're doing to try to help us during this crisis. So with that, I'm going to turn to our friends in News 12 who took the time and effort to be here in the room, more than 10 feet away, and happy to take any questions you may have.
Yes, thank you very much. My question, like you touched upon earlier, we've been seeing a rise in cases in Rockland and Orange counties. Have you been speaking with those respective county executives, and are there any extra steps or, provisions, in the works to try and prevent any increase in cases here stemming from Rockland or Orange?
Well, I think both Ed Day and Steve Newhouse, who are my colleagues, the county executives, are experienced county executives. I have almost 3 years in. They've got a lot more experience than I have. So they're working very closely with their public health department in addressing this, and our public health department professionals are in constant contact with each other to try to discuss the strategies. I think what it comes down to in every one of these counties is, even though we're in close physical proximity to each other, we each have unique demographic realities. Demographic meaning combinations of groups and people and clusters. We have big cities that Rockland, for example, does not have, although they have concentration in some of their villages like Spring Valley. We have in the city of Yonkers at 200,000 people, a city that's almost the population of either one of those two counties. Now in Orange County you do have some urban centers in Middletown, Newburgh, and Port Jervis. But they also have some ethnic clusters that we don't have, and we have some ethnic clusters that they don't have. So when we compare notes, it's general, but we look for the common area ground. So when we have an outbreak in Pleasantville, what did we do? How did we do it? We share that information. And I must say, both County Executive Ed Day and County Executive Steve Newhouse, and for that matter, Mark Molinaro in Dutchess County, Mary Ellen Odell in Putnam, and then my colleagues on the island, Steve Ballone in Suffolk, Laura Kern in Nassau County. They've all been very cooperative with us. We've asked questions, and we've compared notes. Our circumstances are different from Rockland and somewhat different from Orange, so there's not a correlation, step-by-step correlation. But certainly if we see an outbreak that mirrors what they have, then we know we've got the ability to tap into their expertise.
So at this point, you're not overly concerned that anything going on there will have an effect here?
Yeah, I think it's the unique differences between the counties that account for the different numbers, and that's really what we're seeing at this point. But it could change. 5 days a week, one of our staff people, a senior manager, Susan Spear, puts out a map breaking down the different communities and how many active cases and how many total cases we've seen in each of those communities. And we look for those spikes. And in a different county, a specific community might spike, or a village might spike, and that becomes the reason why the overall county numbers are so particularly high. There are parts of Rockland County that look exactly like Westchester County. If you do the river towns, Piermont, Nyack, go up and down the river, they look exactly like our Hastings and Dobbs Ferry, mirror images on the river. When you go inland, things are a little bit different. And there's different nuances that account for some of the challenges that Rockland has or Orange has that's different from our challenges. On the other hand, we're right next to New York City. So, we're border buddies with the Bronx, and the areas of Westchester that border the Bronx, south side of Mount Vernon, southwest Yonkers, look functionally just like the Bronx. So sometimes we're more in common with the Bronx than we are with our other Hudson Valley colleagues.
Yeah, thank you very much.
Sure enough. We'll go to Catherine Chaffee for any remote questions.
So we have a question from David Crowther from the Journal News. People see active cases above 600 after the summer months, of active cases in the 400s and 500s. Those people might start to fear a second wave, quote unquote. How worried should people be at this point? How worried are you compared to the last few months?
Well, I think the key is to understand what the numbers represent. You can't look at just the number. You have to understand what the backdrop for the number is. And I try to explain that at the risk of being boring, at the risk of those folks who are watching. I heard him say this last Thursday when he was getting the shot, and I heard him say this 2 Mondays ago. So, but let me go into it again. The number of active cases reflect the number of people that have tested positive in the last 2 weeks. They haven't cleared the protocol yet, the 2-week protocol. In the last 2 weeks, we have had more robust testing in Westchester County than we had in prior periods of time. And the more we test, the better it is. But even at a low percentage of infection, it generates a higher number of absolute number of positive cases. So that's why you're seeing in the last week, 10 days, maybe 2 weeks worth, many more cases, and therefore those additional cases that come in wind up creating more active cases because the people that cleared from 2 weeks ago is a lower base. That number alone is a number you look at. And it's concerning to answer the question. I look at the number of active cases and it's concerning, but I look for other indicators. And you have to have all of those indicators in line because here's the problem. So you have more people testing positive. You look at that. Now, what's the distribution? Is it geographical? Do you look at a particular spike? What's the percentage of infection? Well, the percentage of infection is low. Okay. So you have more cases, but the percentage of infection against all the people tested are low. Tell me next, how many hospitalizations? Do we have a spike in hospitalizations? We do not have a spike in hospitalizations. Hospitalizations have been stable and slightly on the downturn. And then you look at fatalities, and fatalities have been almost flat. I mean, again, every exception to what I say is a human being who we lost. But those indicators, hospitalizations and fatalities, and the infection percentage rate, when added to active cases, gives you the proper perspective of what we're facing. So, am I concerned? Of course. That's why every day I have my little sheet here. This represents 8 months of handwritten numbers that I pore over. In the same way that in my business career, I would pore over numbers that represented revenue for the projects that I was responsible for in my corporate life. And you read it, and you know it, you interpret it, and then you look for trends. Not just did we have a bad day. We had a bad day on one particular day, lots of positives, way over. Do I get that the next day? The answer is no, I don't. Good. Now I want to see a second and a third day, and I want to see over multiple days, is this a trend or is this just a spike? And that's really what we're looking for. So I'm certainly concerned. I don't minimize it. I'm not sitting here saying, hey, it's okay, it's no problem. It's something to watch and be concerned about. But the other side of the coin is I don't want to say things because people are waiting. Is the second wave coming? Has it arrived? What do we know about it? We'll know by multiple days of bad numbers if that's what we get. And we're not yet at that point. I hope we don't get to that point. I'll give you an analogy earlier in this all. We talked very early about flattening the curve. What did flattening the curve mean? It meant that we had a very fast rise in number of cases, number of people hospitalized, and the number of fatalities. It shot up like a rocket the first 7 to 10 weeks of the infection. In round numbers, we had the initial outbreak of New Rochelle, and then we saw it percolating in other places, and that was of great concern. When we looked at that, our fear there is not how many cases we had. We knew we had cases. Would we exceed the capacity of the healthcare system? And if you recall at that time, we were fairly recent, having watched what happened in northern Italy, in the Lombardy province. And people say, oh my God, could that happen here? Could we overflood our hospitals? And at that time, I talked about how many hospital beds do we have? 3,000 beds. We added another 110 over at the Westchester County Center. And then what was our hospitalization numbers? And the numbers creeped up. It got up to 1,200 people hospitalized. Then it flattened out. The spread didn't continue at the same rate or pace. It flattened out for a period of time, and then it started the slow descent that led us to here. So were we concerned about exceeding the number of hospital beds? Yes. Were we concerned about running out of PPE? Yes, we were concerned. And there were nights where we were getting close, but we didn't run out. Were we concerned about having enough healthcare professionals? We were. If you remember, back at that period of time, we put out an all-points bulletin. If you're a former nurse, if you're a doctor, and you can come back into, give us a helping hand to make sure we didn't run out. And of course, the governor, because we couldn't do this at the county level, the governor was insistent upon making sure we had sufficient ventilators to handle people who got seriously sick. We survived that. We were alert to it. We watched the numbers. We were fearful that we might turn into Italy or China, but we didn't. We were prepared for it, and then we started to flatten out. So that's really the message here. This whole pandemic, I've said this so many times now, I'm just repeating myself. This is a test. This is a test of our maturity. This is not a test if you're conservative or liberal. If you think it's that, you completely miss the whole story. The test is when faced with a crisis, how do we respond? Do we respond emotionally or do we respond logically? And those of us who are not medical professionals, right? We're not trained either in preparing a virus treatment or knowing how to manage a pandemic. We do the best we can. And we ask ourselves questions. Can you open the pools? Can you open Playland? The answer is no, you can't open Playland Amusement Park. Yes, you can open the pools. It's pragmatic response to a crisis. That's what you want in a person who purports to be a leader. And as the leader of this county for this defined period of time, that's what I've tried to do. I've tried to be rational and logical in every one of these things. So I look at numbers. We try to determine with a group of people, not me alone, does this make sense? Do we move in this direction? I get on the phone, I talk to mayors and supervisors. We have a municipal call every Monday afternoon, and we exchange notes. Monday mornings, we have a call with the school superintendents. I'm out in the community where I can be personally, and you talk to people and you understand what's happening. What do you see? What do you see in Portchester? What do you see in Peekskill? What does it tell you? And then you make decisions based off of that. So there's concern, but there's also a rational response to these things. And so far, my observation is, wherever you've succeeded in dealing with disease, it always came out of a rational, non-ideological, professional approach to managing it, as opposed to philosophically close everything down, open everything up. I'm tired of things, open it up. I'm afraid, close it down. Those were emotional responses, ideological responses. And we've tried to be practical. Any other questions? Very good. Well, thank you for watching. We appreciate you tuning in. We will be back a week from today at 2 o'clock to give another update. If, in fact, we do see that something dramatic is happening, we'll give you, we'll plan on doing an update in the middle of the week. And obviously, if we were to, restart and get back to a second wave, we would resume more frequent communication. But we figure right now, as long as the trend lines are as I've described, and the numbers are available for anyone to see, then the weekly update should suffice. I will be delivering State of the County message on Thursday. We'll talk about more than COVID, but how could COVID not be the main story of the last year? So we'll try to address where we think we are as an administration, where we're going forward. I have been given the opportunity in this job to serve for 4 years. We're almost 3 years through. It's been quite a third year, but we continue on, and hopefully we'll communicate intelligently and wisely. I'm George Latimer, Westchester County Executive. Thank you for watching. Have a good week. Stay safe, and we'll see you soon.